Good morning. Today we'll be discussing two very important concepts when it comes to the individual welfare of those diagnosed with autism: empowerment versus care. We will look at whether individuals provided specific treatment and intervention to increase overall independence is more beneficial versus those who receive care in group homes or through various caregivers. We welcome Amy, Charlene, and Yvette, who will discuss empowerment, and Larissa L. and Gabrielle, who will discuss care. Let us start with Amy on empowerment.
Hi, my name is Amy Mosier, and I will be the stater for empowerment this morning. Our first point concerning the idea that interventions for persons with disabilities should focus on empowerment is that increased independence and a high level of self-determination will lead to a higher quality of life. The U.S. Office of Special Education Programs conducted a 10-year national study in regards to self-determination that found participants who self-reported higher levels of self-determination were more likely to demonstrate autonomy when making post-school transition plans. The connection between self-determination and autonomy levels is relevant to our arguments. As LaChapelle and others in 2005 explained, self-determination is one of the 8 core domains that construct a person's quality of life measure. Bailey and Birch wrote that considering a client's perceived level of self-determination and a behavior analyst's intent to improve that client's quality of life supports the second core principle of behavior analysis by supporting the client's independence. Our second point is that, due to recent technological advances, video modeling can now be an intervention utilized to teach students with autism goals that include daily living skills, social skills, reading facial expressions, and basic first aid. Additionally, with widespread access to smartphones, this type of intervention does not require elaborate equipment or materials and can take place anywhere. This type of intervention demonstrates the BACB Ethical Guideline 2.09, Treatment Intervention Efficiency. This guide states that clients have a right to effective treatment and that the behavioral analyst has an obligation to the client to deliver the most effective services possible. Our last point is that choosing interventions that promote independence of our clients can work to change how we view persons with disabilities. Instead of being viewed as victims of their circumstances, they will instead be viewed as contributing members of society that require additional support.
My name is Ellie Cassidy. I'm going to be the stater for care. So according to the BACB Ethical Compliance Code 4.09, least restrictive procedures, behavior analysts should review and appraise the restrictiveness of procedures and allow and always recommend the least restrictive procedures likely to be effective. The key part of this code is likely to be effective. Independent living is absolutely the least restrictive environment. However, this environment isn't always the most effective for the individuals we serve. No one would expect a child who does not have the fine motor skills to hold a spoon to be able to cook a meal independently. This is the same rationale we must use when determining whether a person can successfully live alone and care for themselves. A lot of times, individuals with disabilities have other diagnoses which could inhibit their ability to live alone. Disorders such as pica or Prader-Willi syndrome pose a huge risk to individuals diagnosed with them. If someone eats inedible items such as paper clips, staples, etc., they could seriously injure themselves internally if someone was not there to monitor them. Prader-Willi's is also very serious because the person does not feel full, so they will not stop eating. Individuals who have this condition need to be monitored closely so that their food intake can be limited. Self-injurious behaviors such as head banging, eye gouging, or severe skin picking are also a big concern among the autism community and can be extremely severe. Even if this behavior is infrequent, If there is not someone around to block it when it occurs, it could cause internal bleeding, tissue damage, or even death if severe enough. Therapy for individuals with disabilities is important in helping them become the most independent they can be. However, not all individuals are capable of living alone or having access to the therapies they need. Dudley et al. Says adults living with family may be using fewer services, but have a higher unmet need for services because their caregiver was likely the primary advocate for assessing these services, which places a large burden on caregivers to find and fight for services for their adult. In this image, you can see a table that compares people living with family, people living independently, and people living in supported living facilities, and compares the need for more services, services unavailable or too far away, or unsure where to find services. In supported living facilities, the percentage is much lower than living independently. According to Dudley et al. Study, the need for services is higher in individuals who live independently than those in supported living facilities. Also, services being unavailable or hard to find is higher in individuals who live alone. Group homes are great for these individuals as well as their families because they have access to these needed services such as occupational therapy, speech therapy, vocational therapy, behavioral therapy, and so on. It takes a lot of stress off of the families because they are not expected to find these resources themselves. Certain daily living skills such as hygiene, folding clothes, etc. can still be taught in these more restrictive settings to help with their autonomy, but the focus of programming would not be on driving or managing a bank account if they would not be living by themselves.
My name is Charlene, and I'm providing individuals with disabilities the tools they need to make their own decisions, demonstrate independent nation, and is in increasing study done by Pin Chian Chow in Taiwan dove into the relationship and an individual. To assess this relationship, Chow took 145 college seniors aged 22 to 25. All of these individuals had a range of disabilities, including speech and language impairment, visual impairment, emotional and behavioral disorders. Each individual took the self-determination skill for college students survey as a senior in college and additionally 1 year after they had entered the job market. To assess their quality of life, they also took the condensed version of the World Health Organization Quality of Life Assessment. The results of this study confirmed the positive correlation between a high level of self-determination and a high quality of life. Ultimately, as a service provider, we are aiming to increase each client's quality of life. If we aim to do this, we must program respectively to allow these students to become increasingly independent and hope that it will lead to a high level of self-determinism. Once that is accomplished, the end result will improve their quality of life. When discussing how to program for a client, there are many different factors that weigh in. This includes the parent's wants, the child's current skill set, and most importantly, the BACB Code of Ethics. The BACB Ethical Compliance Code states behavior analysts must use the least restrictive procedures possible. This supports the programming method of allowing an individual to obtain the most independence he or she can. In the recent past, there have been many technological advances that can help these individuals when transitioning out of services and into a new environment, such as a group home, assisted living facility, or even a home of their own. A perfect example of this technology that can increase the independence of an individual is the intervention of video modeling. Video modeling is an intervention in which someone records a skill or a task, and then it is used as a model prompt for the individual learning and maintaining the skill. This has been proven to be effective when teaching functional daily living skills for individuals with autism spectrum disorder. Bereznak et al. Conducted a study that focused on video modeling functional daily living skills. 3 males diagnosed with autism who were 15 to 18 years old were taught how to use a washing machine, to make noodles, and to use a copy machine by a video model task analysis. Each step was played for the student, and the expectation was for them to imitate the provided model prompt. The only help they had from an outside adult was the playing of the next step on the video. As you can see from the graph shown, from the study, the results concluded that each individual's performance drastically increased from the baseline condition.
each individual reached at least 90% accuracy across each task. Additionally, after the task was mastered, the video model prompt was taken away and accuracy levels decreased. If you look at the graph, you can see the data point in which the video model was represented, increasing the skill set again. This supports the evidence that video modeling is effective for teaching functional daily living skills in the short-term future and the long-term future. As Briznak et al. States, these skills will benefit individuals with ASD in employment opportunities so they can efficiently and effectively follow through with various tasks without the assistance of others. Ultimately, that should be the goal when we are striving to reach with our clients, to perform skills in the absence of assistance from others. Therefore, when programming effective interventions, BCBA should focus on programming for an individual to live without the assistance of others. The next slide shows the BCBA Ethical Code 4.09. This states that BCBAs must stick to utilizing the least restrictive procedures possible when implementing interventions. Implementing interventions that can allow the individuals to learn how to follow prompting that does not require a physical prompt from another person, such as video modeling, is a perfect example of implementing a minimal invasive procedure. As we are talking about self-determination, we must first look at what this entails. Wehmeyer details self-determination with choice and decision-making as key components. The OSEP National Longitude Study includes an understanding of one's own strength and limitations in the definition. This is stated to enable the individual to engage in goal-directed and independent behavior. To promote self-determination, we must encourage these skill sets in our clients as service providers and as parents. When looking at the disabled population as a whole, historically they have been viewed as victims and therefore not having the ability to be independent. However, in recent years, the perspective is changing of being more accepting and supporting of this population. As providers, we can set the pace for the rest of the service disciplines and lead by example in a way that shows the disabled population are not victims of a disability, but instead members of our society who need additional help to live independently. We can implement this mindset in our programming. The video modeling prompt study backs the argument that there are skills that can be taught to promote independence. Video modeling can be seen as a behavior class. Once taught to imitate a video model, the limits are unknown. There are studies with effective results of video modeling towards clients with disabilities to increase social skills, making orange juice, mailing a letter, and setting the table, and many more. As programmers, we owe it to our clients to provide the prerequisite skills they need to be independent as they possibly can be. Therefore, programs including but not limited to video modeling are the types of interventions we should focus on. The next slide shows another BCBA code, the BACB code of 2.9, that each client has a right to an effective treatment. Treatments that are effective only in one setting, for example, a clinical setting, does not generalize across settings or is not generalized across setting or people is not an effective treatment. An effective treatment plan must allow for the individuals to have the goal to become more independent in the long-term future.
Hi, I'm Larissa, and I will be talking about care and how we provide supports improving that side. I want to touch base first on talking about IDEA law that requires individuals with disability are to have access to free and appropriate education. And this includes designing an individual education plan that can start as young as 3 years old. In addition, the American with Disability Act indicates that individuals are not to be discriminated against in all public life, such as jobs, schools, and transportation. Next slide will go into more detail on what that looks like within caregiving homes and within their families. What happens to my IEP after I graduate high school? Typically, most kids who are on IEPs get them assessed at age 3 or within their school life. Once a child who ages out, they typically age out at 22 years of age, and a transition plan is established once they graduate high school. An individual education plan looks specifically at the unique needs of every single child and young adult. So we design programs based on what they need and what their goals are. This can include county-based programs that target ages 18 to 22. With county-based programs, they are all-day facilities, and they get to go home at the end of the day with their family. Various community colleges also provide supports and resources for individuals in an IEP through their learning centers. Such programs are offered are workability programs and job training. This can look like within their 8-hour day in their county-based programs up to age 22, they contract with other employment such as hair salons, mail facilities, restaurants, grocers, and help train individuals to access their jobs through folding towels, sorting mail. They also include functional skills training based on their individual needs and social skills development. In addition, they can target behavioral deficits, which can include biting, pica, aggression, and again, as stated earlier, the Prader-Willi syndrome to help control their diet. Some individuals cannot live independently, so these programs give them the skills to access their environment that's suited specifically to them. Other skills targeted, they do learn to budget while earning a paycheck, functional skills such as laundry, cooking, paying bills, and accessing transportation within their community. Academic tasks such as reading, writing, being able to address an envelope, behavior management strategies such as intervening on safety, such as aggression, running, eloping, and then parent training and other support. So typically within a county-based adult living skills program, when a child has an IEP, parents are involved in the process, and a lot of the county-based workers will provide parent training and other supports in how parents can access respite care. They can access their regional center to be able to maintain treatment and caregiving within the home where a child feels the most safe and secure or an adult feels the most safe. Next slide, we'll discuss each one looks like. So several research has been done on PEERS program. Initially, they did the PEERS program to work on targeting social skills among individuals who are in caregiving settings, such as group homes or within the home of their parents. They wanted to focus on increasing their social skills as well as managing behavior. Their goal was to target them making friends, having the interverbal exchanges, and what happened was the family life ended up becoming less chaotic and less stressful due to the individuals with autism leaving the home to be provided in a caregiving setting and receiving these supports. And the parents were able to get more things done and be able to be more present and develop tools and strategies when the children were not in the home or the young adults to be able to access their ability to parent more effectively and to intervene appropriately on such behaviors that are safety concerns. So overall, it decreased stress within the home and the caregiving setting. It decreased overall chaos in the home or caregiving setting, and an increase in parent and caregiver feeling successful supporting their aging children. In addition, there are programs that parents can access that are free or low cost called respite care. This is when individuals who are trained come into the home and give families an opportunities to have a break, as well as provide training to the families on how to target specific behaviors and skill set they want their adult to learn that's specific to their needs. This is, again, low cost to families or free, and parents will feel more successful when they're provided the tools and strategies in their caregiving home. Respite care is also provided in group homes when targeting specific needs of each individual within the home. Group homes are another avenue that individuals go to, which teaches various independent living skills and social skills training. So a lot of the times it's in a more controlled environment, but it helps the child access or adult access their environment more effectively. Access to workability programs. What they noticed in one research is that adults with ASD who are provided specific training are able to have more success and access specific job skills such as mail sorting, photocopying, and customer service when provided training within a group home setting. In addition, group homes maintain safety and behavior management techniques to provide all individuals who have these safety concerns an environment where they will not harm themselves or others, as well as provide training to parents on different techniques to maintain safety within the home as well. Regional centers are among the national standards of nonprofit. Most states have access to regional centers, and they provide low cost or free services and interventions to families and caregivers. This can include occupational therapy, physical therapy, speech therapy, behavioral therapy. They are provided various community resources to families. This can include training, conventions, family support groups, social skills training, social groups, and they provide various trained in case management, So every family is assigned a case manager, and all of the goals are established based on the needs of the family and the adult. And various placements are assigned once they be assessed.
Hello, my name is Eva, and I am presenting an attack on the CarePoint. Aiming for empowerment is treatment goals is to give individuals an opportunity to achieve self-determination. Since individuals age out at 22 IEP goals, and in most cases they age out of insurance for certain services, many families and individuals with ASD are left with limited assistance. Larissa points out when I'm sorry, did something happen? Empowerment and treatment goals is to give the individual an opportunity to achieve self-determination. Since individuals age out at 22 for IEP goals, and in most cases they age out of insurance for certain services, many families and individuals with ASD are left with limited assistance. Larissa points out that when children age out of their IEP, they are limited to staying home with family members or being placed in the care community. But what happens to those individuals who lose their caregivers, or their caregivers do not have the resources to enroll them into these care services? Just as Amy discussed earlier, the interventionist should strive to help clients become as self-sufficient as possible instead of immediately preparing clients for a care life. In the next slide, Michael Waymeyer and Susan Palmer conducted a study in 2003, which analyzed the outcome of individuals with cognitive disabilities 1 and 3 years post-high school. The graph shows that the subjects included individuals with low and high self-determination skills. And as you can see, all individuals have increased in self-determinations and the skills of paying rent, utilities, phones, and groceries at least 5% from 1 year to the 3rd year. The workability and transitional programs Larissa mentions are not available everywhere. The one located in California requires that the site place 25% of their students in paid employment. Where does that leave the other 75%? Treatment of empowerment is still needed to help decrease the amount of individuals who end up in the care system. If we teach empowerment from early on, and there are additional resources such as workability programs and transitional programs, the transition into adulthood can become much more smoother and successful for individuals with autism. Elle brings up a great point that can be used to strive for autonomy. In my next slide, you can see some pictures in which children are using daily skills that can be applied into the work setting. I think the problem with the controversy is that we like to think all or none. Teaching skills such as folding clothes, picking up toys, or washing dishes can be useful outside of care and independent living settings. These are skills that can be used in a job setting as well. During interventions, these independent skills can be generalized, such as folding laundry at a laundromat, or washing dishes at a restaurant, or picking trash in a community area, or putting stocks back into the designated shelf. Taking into consideration the skill sets of each individual that they already have in their repertoire can be the first step in finding empowerment for their adult life.
Hi, my name is Gabrielle Hujnaki, and I'll be presenting the attack on empowerment. According to Bezernak 2012, prior to the implementation of video modeling, staff was used to set up the prep materials, such as placing the food needed to cook a meal next to the microwave, and an iPhone being set up where the participant only needs to press play. As video modeling may be a good intervention for self-monitoring, due to the use of staff members setting up the material, it would not be the best for independent living. What does an individual do when there is no one there to set up the materials? In order for the intervention to be effective for independent living, I believe there needs to be no interference from the staff conducting this study. During the video prompting, self-prompting section of the study, staff also interfered by blocking in the incorrect response and prompting the correct response, which proves that this intervention is still clearly not independent. The study was also conducted with 3 adolescent males aged 15 to 18. In order for the results of the study to be considered effective, there needs to be a higher number of participants and higher variability in the participants choosing, such as demographics, adding females, and much more. The graph depicts each 3 of the participants and 3 behaviors chosen to study. According to Weimer's study, The Relationship Between Quality of Life and Self-Determination, an international study conducted concluded that a new question has been brought up. Support services have engaged in higher activities that involve doing activities or actions for those with ID, but have struggled with allowing the individuals with ID to do things for themselves, meaning that support services are a necessity for those individuals with ID. The next step is creating a system that allows for individuals to have independence, but still supporting the individuals when they need it, meaning that although empowerment may be a good thing for the individuals, care is the lesser of evils. In conclusion, empowerment allows the individual to be independent, but care offers the individual to be independent while receiving services that are necessary but not too intrusive.
Despite the well-stated counterpoints made by the opposition, the main argument for empowerment of individuals diagnosed with autism remains. It is a core principle of the practice of behavior analysis to promote a client's independence. While the needs of some clients may make living completely alone impossible, as behavior analysts, we must still strive to design goals that allow our clients to become as self-sufficient as possible. Additionally, due to the use of video modeling and smartphone use, the most effective intervention may be the one that can be delivered in any location through the use of this technology, including a family or group home if that is determined to be the least restrictive environment in which we can provide services. Finally, changing the way that we prioritize service choices for clients may not only change personal outcomes for these clients, but change the way society views people with disabilities as well.
Many individuals with autism don't have the intellectual capacity to live alone or have other disorders or self-injury that prevent this from being possible. We must always take the best interest of the client in mind when determining their programming. If we know that someone is not going to be able to function independently on their own, we would not want to waste time teaching them how to balance a checkbook and more time teaching leisure or social skills. Someone could have a very good quality of life in a group home without knowing how to cook a full meal or manage money. But if they do not have the social skills to hold a conversation or don't have the skills to entertain themselves in their free time, they could become bored or even depressed. Especially for individuals who have a lot of motor or vocal stereotypy, It is unethical to allow them to engage in those behaviors for the rest of their lives with little to no interaction with others. Programming should focus on teaching them how to play games with others or how to sit and attend to a movie. The client's well-being should always be our number one concern, and helping them be the most independent, happy, and successful in whatever environment they are is imperative. And these are the questions from the professor. The first question is, how does your topic approach the core ethical principles? The topic of whether the field of ABA should turn to care or empowerment is ultimately up to the client once the client comes of age for decision making. So in regards to how the topic approaches the core ethical principles is that it relates to all 9. Second question is, why is this important to the field of ABA and the interventions? The direction in which ABA should go, whether it be care or empowerment, is a critical topic to the field of ABA and the interventions. If care is chosen, then the interventions need to be focused towards that type of environment and the resources that would be needed. If empowerment is chosen, we would need to begin training those individuals, providing services to now go into the individual's home and provide the services. The types of interventions chosen would also be drastically different. If the empowerment route were chosen, programming should be focused on daily living skills and teaching the client things that they would encounter when living alone. If care is the end goal, then self-help skills would not need to be the main focus of programming and intervention. The last question was, how does consideration of this topic enhance practice and or address current issues? The consideration of this topic enhances practice because it allows the service providers, clients, and the clients' families to weigh the pros and cons to each side of this debate, in which the client overall has the legal right to choose which route to take when he or she comes of age.
Thank you so much for joining us on this debate. Please refer to the reference pages on all of our research.